Okay, they should have did those little things go away.
Good morning, good afternoon, and good evening. Welcome. I think we'll get started. It's 8 o'clock. My name is Stephanie Mullen. I'm the project director for TBDIA. Thank you all very much for joining us today for our webinar on new tools and guidance for TB monitoring, evaluation, and surveillance. Next slide, please. And you can go to the next slide. Just a quick summary in case you are new to our project. TBDIA is a global 5-year cooperative agreement, one of the first projects funded by USAID to support their global accelerator to end tuberculosis in 2018. It's an associate award under the Measure Evaluation Project. Measure was a 20-plus year project to strengthen health information systems, including TB. TBDIA's overall strategic objective is to ensure demand, analysis, and use of TB data to inform national TB programs and USAID interventions and policies. Next slide, please. TBDIA has 3 result areas that are intrinsically linked. We support national TB programs and partners to strengthen the collection, analysis, and use of TB data, to improve performance-based monitoring and evaluation frameworks and information gathering processes, including new tools and methodologies, and to strengthen reporting and communication practices to address knowledge gaps and share methods, tools, and approaches, making sure data is being packaged and communicated in a way that can be easily digested and used by a wide audience. Next slide, please. We are working in USAID's 24 priority TB countries highlighted on this map. We also have additional field funding to respond to direct requests from countries. Currently, we have field funding from the Kyrgyz Republic, Uzbekistan, Cambodia, DR Congo, Nigeria, and Eastern Europe region, which includes Armenia, Azerbaijan, Georgia, Moldova, and Ukraine. Each scope is different, but the common themes are to improve integration and enhance access to existing TB data platforms and strengthen M&E capacity of staff involved in collection, analysis, and use of TB data. Next slide, please. I'm very pleased to present our speakers today. Dr. Savim Amidov is the TB HIV Prevention and M&E Team Lead for the TB Division for the Office of Infectious Disease in the Bureau for Global Health for USAID and the AOR for TBDIA. Savim will share a few opening remarks. Babis is a data scientist and team lead with WHO's Global Tuberculosis Program, coordinating global work on strengthening TB surveillance systems, designing and implementing priority epidemiological studies, and using corresponding data to guide policy, planning, and programmatic action. Megan is a monitoring and evaluation advisor with USAID's Washington TB Division. She focuses on USAID's TB strategic information efforts and leads the performance-based monitoring and evaluation framework activities on the team. And we'll end with a Q&A session. Just a few quick housekeeping items before we begin. We'd like to start by inviting everyone who's here today to let us know who you are and where you're from, what organization you're with, and what country you're in by putting a note in the chat. Please use the Q&A feature for your questions. That will help make sure we're able to answer everything either in the session today or in written follow-up afterwards. You can ask a question anytime, and we'll answer your questions during the Q&A period we've set aside. This webinar is being recorded, and a link to the recording and the presentation will be distributed after the event by email. Next slide, please. I'll now invite Savim to say a few opening remarks.
Thank you very much, Stephanie, and please allow me to say greetings and warm welcome to all of you who took time today to join this webinar. I'm really excited and pleased to share with you some of the so-called new tools and developments related to TB monitoring and evaluation, as well as surveillance systems. As Stephanie mentioned, today's webinar mainly will be focused on two main points. One is to provide an update on the WHO upcoming WHO surveillance guidelines, and the second main part is to provide an update on our USAID so-called performance-based monitoring and evaluation framework, or as we refer to it as PBMEF. I see some colleagues have joined from USAID missions and others who are familiar with the PBMEF. But for those of you who are not as familiar, maybe just to put this in a context, why we have been working hard on developing and updating performance-based monitoring and evaluation framework. In 2023, the main rationale is that last year USAID developed its 8-year global tuberculosis strategy, and as part of that strategy, we also put together this results framework, as you can see, with very specific targets by 2023 of reduction of TB incidence rate by 35% and the TB mortality rate by 52% in the 24 USAID bilaterally supported countries. In those targets are very much aligned with the global NTB strategy, which was developed and promulgated by WHO. In addition to that, though, as part of our strategy, we have the so-called 90-90-90 plus prevention results framework, as you can see on your screen, to have 90% of the incidence TB cases diagnosed and initiated on treatment, and similarly for the drug-resistant TB cases, initiation and on diagnosis and initiation on treatment, as well as 90% treatment success rate for both drug-susceptible and drug-resistant TB, and to provide TB preventive treatment to 30 million individuals. Where the PBMEF comes is really helps us underpin and develop a standardized and systematic way for us to be able to track how we're making progress on these results. That's really the main one of the main reasons why we have developed the performance-based monitoring and evaluation framework. And just to say that the 90-90-90 plus prevention, those results and those targets are also aligned with the recently adopted UN high-level meeting commitments and targets on tuberculosis. So in terms of how the PBMEF is also we will have a chance, and I'll turn it over soon to Babis to walk us through an updates to the WHO surveillance guidelines. But just to say that PBMEF and the WHO surveillance guidelines are very much synergized, and it is really great to see that synergy and complementarity, and how critical it is for us to have both of those tools as a global TB community. And finally, I would like to extend my sincere appreciation to the TB data special interest group, which we have set up, and which is chaired by my distinguished colleagues from the USAID mission in India, Dr. Amar Shah, and my colleague here at USAID, Anna Meltzer, and really to also recognize the role that the TB SIG, the TB Special Interest Group, that group that has played in development of the performance-based monitoring and evaluation framework, and also welcome those of you if you're interested to join the TB SIG. Without further ado, I'll stop here, and again, welcome everyone and thank everyone. And with that, I'll turn it over to my distinguished colleague, Dr. Babis Asismanidis, to walk us through and provide the review and updates on the WHO surveillance guidelines. Thank you very much, Babis. Over to you.
Many thanks, Sevim, and hello, everyone. Many thanks to the USAID and TBDI colleagues for the opportunity to talk to all of you about the upcoming WHO guidance on TB surveillance. What I will be trying to do over the next 20 minutes or so is obviously provide you with a summary, rather than go into the details, a summary of the contents of this upcoming guidance. Next slide, please. So in order to set the scene, just to explain that at WHO, for the space of data, we have been carrying out work under the auspices of the WHO Global Task Force of TB Impact Measurement. So this is a major advisory group comprising a large number of national TB programs from around the world, as well as all the major technical and funding partners from the global TB community. And really, we're organizing our work in 4 strategic areas. So the first one around strengthening national surveillance notifications systems for TB. The second one around periodic studies, so improving our understanding of tuberculosis burden through periodically implementing studies such as prevalence surveys, drug resistance surveys, patient cost surveys, inventory studies, etc. The third area of work on the periodic review of methods that we use at WHO to estimate TB burden. And then finally, a strategic area of work around the promotion of analysis and use of TB data at the country level to guide policy planning and programmatic action. Next slide, please. Once more. For each of the 4 strategic areas of work, we develop guidance and products to facilitate the implementation of the work at the country level. So what I will be focusing today on is the strategic area of work on strengthening surveillance systems for TB, and in particular, the upcoming guidance on TB surveillance. On this slide, you see a few of the products that we have developed over the years to support countries while they are in their efforts to strengthen surveillance systems for TB, such as the surveillance assessments, for the checklist of standards and benchmarks that you see on the slide, or the the yellow book on supporting countries to transition to digital surveillance systems, or all the work that we have been doing over the last few years on developing metadata packages in DHIS2, and more recently the software agnostic guidance that we have developed to support countries transition from paper to digital surveillance systems. Next slide, please. Once more, and why is there a focus on surveillance systems? Well, because harnessing the power of reliable, routine TB surveillance data allows national TB programs around the world and their stakeholders to be able to monitor TB trends over time, by geography, or for specific populations who are at risk of TB infection and TB disease. And really using all these data in order to inform decisions on TB prevention and care activities, as well as policy activities, as well as resource allocation activities. Next slide, please. So in the world of TB, there was early on recognition of the importance of standardizing, recording, and reporting of data for TB that were collected around the world. So in the mid-90s, along with the NTB, with the DOT strategy, there was a specific component on monitoring and evaluation, reporting and recording that was a main part of the DOT strategy. So that was the first time there was a product, there was guidance that was asking countries to collect standard data and report standard data to WHO. Since then, there were two updates: the 2006 update, which introduced the disaggregation of cases by age, sex, and HIV status. And then, of course, with the introduction of GeneXpert in 2013, there was the other major update where the introduction of these new case definitions. So we moved away from the smear positive, smear negative to the bacteriologically confirmed, the clinically diagnosed case definitions. So now 10, 11 years almost later, we have the new update of the guidance of TB surveillance, which has an expanded scope and content, and it is going to be published in Q1 this year. So in fact, we're hoping to have the English version published and released in March, so next month. And we are also going to be releasing Spanish, French, Arabic, in fact, also the Russian and Chinese versions later this year. So all 6 official UN languages. Next slide, please. So this is the content of the guidance on TB surveillance. There will be 7 chapters. There's the introduction. There's a chapter on the purpose, principles, and scope of the surveillance. There's a chapter introducing and explaining all the definitions. There's a chapter on core indicators to report and use. A chapter on the core data items to collect in order to be able to report those indicators. There's a new chapter on digital TB surveillance and another new chapter on data quality. So what are some of the processes that can be put in place to improve the quality of the surveillance data? And then there are also 6 associated web annexes. The first one is synthesizing work that has been done from over 130 epidemiological reviews in more than 100 countries around the world over the last 10 years. So we have synthesized all the information, and we are presenting some commonly observed problems and suggested, or associated rather, solutions to those problems. There is an annex, or there is an annex on the WHO TB surveillance checklist, and that is the 2nd edition. So this is the new edition of the surveillance checklist that looks at strengths and weaknesses of the surveillance system. Web annex, the 3rd web annex is focusing on guidance on record linkage to deduplicate surveillance data and to also measure underreporting of people with TB disease into the official surveillance system. There is an annex that provides the templates and formulae for the reporting of aggregated data and the calculation of core indicators. There is an annex providing examples of reporting scenarios for diagnosis, start of treatment, and treatment outcomes. And then finally, an annex that evaluates the synthesis, rather an evaluation of the synthesis of the implementation of case-based DHS2 surveillance systems in 5 countries. Next slide, please. What I will be doing is providing you with some key material from each of the chapters and some of the web annexes. Of course, I will not be able to cover everything, but just to say that as soon as the guidance is published, hopefully next month, we will also be having dedicated webinars and also providing opportunities for our colleagues at our counterparts at the country level and their partners to engage with us and really ensure that the implementation of the material that will be featured in the surveillance guidance is done optimally. So what is the rationale for the update? Next slide, please. So we are making sure that it is fully aligned with the WHO NTB strategy. Remember, the last update was in 2013, so that was during the Stop TB strategy era. We're now in a new global strategy for TB. So there was a need to align the guidance on surveillance with the NTB strategy. Next, please. To also make sure that the updated WHO guidelines on TB prevention, diagnosis, and treatment are addressed. Next, please. To make sure that we're addressing the common problems that we have seen in over 100 national, in over 130 rather national TB epidemiological reviews in 100 countries. Next, please. To promote case-based digital TB surveillance. Next. And then to also address the growing demand for real-time data. Next slide, please. What are the principles that we have used during the development of this guidance? We are ensuring that it is based on clear, comprehensive, and standardized definitions. That it is the guidance talks about presents indicators that are required for data that will actually be used. Next, please. That it is applicable to both case-based digital and manual aggregated reporting systems, but overall is promoting the transition from paper to digital surveillance systems. That the data are checked for completeness and accuracy, and that the frequency of reporting of certain indicators varies according to the intended use. And these are things that we are promoting countries are considering while they're developing their surveillance system. Next, please. And then finally, to make sure that every country in the world is benefiting from the experience and lessons learned in other countries in their efforts to strengthen surveillance systems overall. Next, please. So the scope, as I said, is expanded for this guidance. So we are recommending considering and implementing a surveillance system in a country that is able to seamlessly collect information on data on the same individuals as they go through the full pathway of prevention and care for TB. So from screening to diagnosis, to treatment and management of comorbidities, as well as post-TB care. And we're also recommending the development of a surveillance system that seamlessly collects data on the same individuals from different locations. So while the data that are collected at the health facility level still remain the backbone, we're also recognizing the fact that, in fact, the same individual data on the same individual are also collected at the laboratory level, but also at the household level, particularly within the promotion of TPT and all the prevention activities. So we need to consider the surveillance system for TB in a holistic way to be able to, and address all these issues. And quite importantly as well, we need to make sure that the surveillance system for TB is not a separate system, an independent rather system, but that is part of the overall public health surveillance architecture, and that it fully is interoperable with the overall health system. Next slide, please. So as I said, so these are some examples of changes. So I'm listing here the key changes in terms. So we are referring to what used to be called the relapse case to recurrence to make sure that the definition aligns better with the definition that is being used in TB clinical trials. We are referring to re-registration for treatment rather than retreatment because it is a simpler and more accurate descriptor. And we are, instead of talking about new relapse cases, we're now referring to new episode of TB. Next slide, please. There are also some changes in definitions. So what we are promoting is this idea of using the same definitions for treatment outcomes for people with drug susceptible and drug resistant TB. So we are simplifying and streamlining definitions for treatment outcome for all people with TB, irrespective of their drug susceptibility status. And then we're introducing this change of treatment failure, of any change rather in treatment register, treatment regimen to be recorded as a treatment failure. Next slide, please. We're also introducing and promoting rather that that countries are monitoring on the pathway of prevention and care and monitoring treatment initiation. What we used to see as part of the epidemiological reviews was people who were diagnosed with TB disease but were not started on treatment. Oftentimes they were not reported on to register. So we are now introducing this indicator to be able and monitor that, to really be able and monitor individuals who are diagnosed with TB disease and do not start treatment. And for that purpose, we're also introducing this this new concept of case outcome categories. So we still have the treatment outcome categories for individuals who start treatment. And we're also introducing this concept of case outcome categories for the cohort of individuals who are diagnosed for TB, but not necessarily start treatment. Next slide, please. We are also introducing this idea of the reporting frequency of certain indicators. So there are some indicators that need to be reported rapidly, such as case notifications. Next, please. There are some other indicators that need to be reported on a regular basis, as of the quarterly level, and then next, please. Also, the indicators for consolidated reporting or annually, and we are presenting these indicators in Chapter 4 in such a way. So there is a section on indicators, recommended indicators for rapid reporting, for regular reporting, and for consolidated reporting. Next slide, please. This is just to provide an example of what the different types of indicators, which are the objectives that some of the different types of indicators are addressing. So we're listing here 5 key objectives for the surveillance system. So monitoring of TB epidemiological trends, the timely detection and investigation of sudden or unexpected changes, the assessment of progress towards national and global targets, the assessment of performance of TB services, and then finally inform the policy planning and programmatic action. And each of these objectives are addressed by specific indicators that are reported in different frequencies. Next time, please. Next slide, please. Again, there is a lot of material in this chapter, so all I want to do here is show you the groupings of indicators and what our recommendations are. So there is a group of core set of TB surveillance indicators for annual reporting, that we are recommending that countries, irrespective of whether they have a paper-based system or a digital case-based system, should be collecting and reporting to us. Next slide, please. Then there is another group of indicators that we are only recommending countries with a case-based digital surveillance system report to us. That doesn't mean that these are not important indicators. These are extremely important indicators. But what we have seen in the past in countries with paper-based systems, particularly for these indicators that you see on this slide, there were major quality issues because these are indicators that require a digital system that require good data linkages between the health facility level and the laboratory, for example. So far, what we experienced from these from the epidemiological reviews that we carried out was that a lot of these indicators had major data quality issues in countries with a paper-based surveillance system. So we decided to still recommend them and still say that these are important indicators. But for countries with paper-based systems, the idea is to put their effort into establishing a digital case-based surveillance system and then try to report data on these indicators. Next slide, please. And then we're also suggesting some additional disaggregations and some additional candidate indicators, again, for countries with digital case-based system. That doesn't mean, of course, that countries with paper-based system cannot also report this data. But we are just making sure to share the lessons learned from countries with paper-based system that have attempted to report data to us in the past, and there were some major data quality issues. So we are really asking countries to put their effort into strengthening their surveillance system and fully transitioning into a digital case-based system with high coverage and of high quality before they move into reporting of these additional indicators. Next slide, please. On chapter 5, on the core data elements to collect, so there's a number of tables here that are presenting the data elements that are required for the definitions of the indicators that appear in chapter 4. And this is again an excerpt of a key table. We are presenting data elements and then some suggested categories for each of those elements. Next slide, please. On the chapter on the digital surveillance system, we are defining and talking about the advantages of the case-based surveillance systems over paper-based systems. We are presenting a series of prerequisites that need to be in place for digital case-based surveillance systems to work in practice. And then we're also providing some examples of digital packages that we have developed at WHO in collaboration with the University of Oslo and DHS2. Next, please. Next. Yes. So in this chapter, we are talking about the development of a digital environment that will allow us to capture information at all these different locations where TB services are offered and along the full pathway of prevention and care. We're providing a number of country examples with digital case-based systems. We're providing a lot of material from the DHS2 digital packages, and we're also talking about the software agnostic material that we have developed on for countries that do not want to use DHS2, but rather a different software of their choice. Next slide, please. And then finally, on the chapter on data quality, we are defining some dimensions for data quality that we think countries should be considering. We're talking quite importantly about data governance and design features of the TB surveillance systems that need to be in place in order to ensure data quality. And then next, please. We are offering some example data validation checks throughout the whole pathway of collecting data at the health facility, compiling, aggregating, and sending upwards data, and then finally consolidating, analyzing, and using data. So for all these steps in the data flow, we're providing some suggested validation checks. And next, please. And then also talking about the introduction of periodic evaluations of data quality, either in the form of routine assessments that the TB programs can do for themselves, or in the form of a formal assessment, such as the surveillance checklist of standards and benchmarks that I have talked about. Next, please. So a couple of words on the web annexes. So web annex, the first web annex summarizes the commonly observed problems and suggested solutions that we have found from surveillance systems. So you will see here we have grouped them into system-associated issues and data-associated issues. Under system-associated issues, there were some commonly observed problems around system coverage, system fragmentation and interoperability, and system implementation and scale-up. Whereas under the data-associated issues, we have grouped these messages under data collection, data management and quality, and data analysis and use. And for each of those categories and problems, we are suggesting some, we're proposing some associated solutions that countries have used from around the world to address them. Next, please. This is the surveillance checklist that has been used as part of all epidemiological reviews I have already talked about. And this is a tool that allows TB programs and their partners to really understand what the strengths and weaknesses of the surveillance system are. We have this new edition that is now including standards on treatment outcome and the quality of programmatic management of TPT data to fully align with the expanded scope of the guidance that I have already spoken about. I will not go into details, so this should soon be available for all to see. Next slide, please. So this is a new concept, rather new material that we have developed on record linkage. And record linkage is a major component of what we have been carrying out in the TB world called the TB inventory study. So this is essentially an opportunity to try and see out of the official TB notification data and compare that, the official TB notification data, with other TB databases in the country, such as data from the National Health Insurance System, or from data from the HIV department, or from a vital registration system, or from the laboratory network. So to be able and carry out these record linkage exercises and understand if there are some people with TB disease who have been diagnosed and are being treated for TB that do not feature in the official surveillance system. So next slide, please. Hit next, please. So that allows us to do what? It allows us to measure the underreporting of TB from the public sector or the private sector or other parts of government. So we have developed this job aid, so countries can use that along with software, Elixir software that is available for free to be used for these exercises. And next slide, please. And I think that's my last slide, just to say that we are still, even if we are promoting the transition to fully digital case-based surveillance systems, we recognize that a lot of countries in the world are still using paper records and paper registers. So we still have an annex that is providing quarterly and annual reports and calculations of court templates and formulas. So that's what existed in 2013. It's been, of course, updated for the current scope and new indicators, but that is still there. And I believe that has been deemed quite useful from countries in the past. So we made sure that we update and still publish this material as part of this guidance. Next, please. I think that's it. Just to say that if you have any questions or would like to contact us about any of that, please feel free to do so. And yeah, just to acknowledge and thank my team for the work that I have just presented. I think now over to Megan.
Thank you, Babis. I'll just jump in here. Just a quick reminder, and thank you, Babis, for that comprehensive overview of the new surveillance guidance. I see a lot of people are excited to see that come out in March. So thank you for all the hard work on that. But just a quick reminder, please use the Q&A feature for your questions. You can ask a question anytime and we'll answer in the Q&A period after Megan. So I'm gonna go ahead and pass it over to Megan.
Thanks so much, Stephanie, and hi, everyone. Thank you all for joining and being with us today. So my name is Megan Peterson. Again, I'm a monitoring and evaluation advisor with USAID Washington, and I'm gonna flip off my video for the rest of my presentation. So this next part of the webinar will focus on USAID's M&E framework, which is known as the PBMEF. So while this was designed in accordance with USAID strategy and priorities, the framework is available online to everybody and can be a useful tool for any country. So next slide. All right, so we'll start this section off with a brief background to introduce the PBMEF, which stands for the Performance-Based Monitoring and Evaluation Framework. So this framework is the cornerstone, really, of USAID's M&E efforts and allows for accountable tracking of TB investments. The PBMEF provides a number of very important components, and principal among them is a set of standardized indicators that have been vetted by technical experts and are aligned with established global indicators where relevant. Notably, the indicators are fully aligned with WHO indicators where those are available. And then the framework does build on those standard indicators to go a bit further with some additional data elements. The framework also provides recommendations for sets of indicators based on specific technical areas, as well as recommended cascade analyses and how to use standardized indicators to construct them. Next slide, please. So the original framework was informed by existing strategies, such as the US government's Global TB Strategy from 2015 to 2019, the Global Plan to End TB from the Stop TB Partnership, and the UNHLM Declaration, as well as WHO's NTB strategy. So since the original publication, new documents have been adopted, including our new USAID Global TB Strategy, which I'll go into in a bit more detail on the next slide. So some of this is a bit of repetition. Savim did mention our strategy document, but I wanted to highlight it again since it is such an important piece of what we're doing. So to briefly review, the strategy document is highlighted here, and the link, which I believe will be posted in the chat. The strategy is a fairly concise document. It's not all that long. It features the results framework, though, that it's very important and we heard about earlier. The results framework is also shown here on the slide, and I'm highlighting in that red box the place where the 90-90-90 plus prevention is coming from. Since this is so important, I'll just reiterate that our 90s are 90% of incident TB cases diagnosed and started on treatment. The same for drug-resistant TB cases, diagnosed and initiated on treatment, and then a 90% treatment success rate for DSTB and DRTB, and TPT to 30 million contacts of people with TB, so that does not include PLHIV. So in addition to that results framework, we're also highlighting here on the slide the strategic objectives from the strategy document. So the overarching objectives are to reach every person with TB, cure those needing treatment, prevent new infections and disease progression, all while scaling up innovations and fostering local ownership to sustain progress. Next slide. So in addition to this new strategy, new guidelines and targets have come about from the WHO and from the 2023 UNHLM. Additionally, a piece of legislation called the End TB Now Act of 2023, or ETNA, as we are calling it, has been introduced in the U.S. Congress, and that will bring with it some additional reporting requirements. So to address these changes, we've been working to update the PBMEF using the TB Data SIG, or Special Interest Group, as the governing body for all changes. So the revisions will ensure that the PBMEF meets reporting requirements, supports countries in reporting on standardized indicators, and aligns with ongoing changes. Next slide. So I mentioned the TB Data SIG on the last slide and wanted to give a bit more detail here. This is a group of technical experts and people involved in all facets of TB programming, and it serves as an advisory board and the governing body for the PBMEF. So any changes to definitions and indicator lists are vetted and discussed through this group. So if you are interested in joining the SIG, we're sharing a link here on the slide, and then David has also just placed that in the chat. Thank you so much. Next slide, please. So getting back to the overall PBMEF revision, we wanted to show an overview here of the process, which has been designed as a three-phase process. Phase one was to agree on a list of essential indicators, and phase two was to finalize standard indicator reference sheets for each of those selected essential indicators. These two phases are completed and have resulted in interim publications that I'll review in a moment. Phase three of the revision is currently in progress and includes revisions to an overall guide document and an extended list of indicators. The extended indicators are also vetted standardized indicators that are made available to provide for more specific monitoring needs where additional detail is desired for your project. Next slide. The full suite of PBMEF tools is shown here. I will review the documents that are available now in the next section, but just to highlight those bottom two, that we also expect the full indicator compendium, which will include the extended indicators, as well as a fully revised guide document in the spring of this year. Next slide, please. Okay, so I'm going to take, this next section to review the interim documents that we now have available. So this was a tremendous effort from USAID technical teams as well as the SIG. All put in a lot of work to shaping up these documents. So we're excited to announce that right now we have available an interim indicator compendium along with an accompanying indicator matrix, which is just an Excel-based summary table for the indicators. And then additionally, we have a MEL plan template, which is a monitoring, evaluation, and learning plan template useful for partners that are designing their MEL framework. Next slide. So to review that first document that I mentioned, the PBMEF tuberculosis indicator compendium and matrix, the compendium document includes that essential indicators list that I've mentioned. It also includes standardized indicator reference sheets for each of those essential indicators and a summary table or matrix to summarize these indicators. So the static version of that summary table appears in the compendium, which is a PDF document, but we've also posted it in Excel format to make it a bit more user-friendly. Just a note that the original publication is still available for the extended indicators, and it will be replaced when the full revision is complete. Next slide. So I wanted to just highlight here what an indicator reference sheet looks like. So when we're designing these, we want to really emphasize that indicators need to be clearly defined and unambiguous, especially if they're going to be standardized. So with the help of, again, the SIG and USAID technical experts, these reference sheets were developed for all essential indicators. So they help to define the overall data element as well as the numerator and denominator if applicable. And they also help us to understand how the data should be disaggregated, recommended disaggregations, how it should be reported, recommended analyses. Those types of things are all available there. So they're great resources if there's any confusion around definitions of indicators or additional clarification is needed for what technical experts are recommending. So these are, again, available now on the website that was shared. And this is an example for a reference sheet. This indicator is for TB detection rate or treatment coverage. Next slide. So the final document that's been available now at the interim is this MEL plan template. It's fairly self-explanatory, but it does include 3 parts. There are section by section instructions for designing an M&E plan for your activity. Then there's a blank fillable MEL plan template and a sample MEL plan to give an example of what that would look like. It's intended as a tool for projects with TB funding. This template is not mandatory, but it is highly encouraged. And we do highlight throughout the template categories that are mandated by USAID's ADS for projects receiving funding from USAID. Next slide. All right, so in this final section, I want to review the essential list of indicators that are currently available. I won't take time during this webinar to go into the specific indicator lists, but I will spend some time explaining how they're laid out and grouped in the current interim publications. So one notable feature of this new publication are additional levels of PBMEF indicators that are shown on this slide. So you've heard me mention the essential list of indicators, all of which were selected for their critical importance in monitoring TB programming. But within this group, there are 4 categories to review. The first are the PBMEF core indicators, not to be confused with WHO's core indicators, but these are 10 well-established indicators that should be familiar for USAID TB bilateral countries. The next category is Core Plus, which add additional data to the core. Next are national level indicators, which we would expect to be available at national level, but may not be, followed by more specific project level indicators that may not be available at national level, but still provide critical insights. And finally, there's also a long list of extended indicators to meet more specific activity needs. Just to repeat, this extended list is not yet revised. Next slide. So there are quite a few indicators to keep track of. So I do want to highlight the Excel-based matrix that I mentioned earlier as a useful tool to look up indicators by various fields. Note too that there's a column to show the WHO equivalent for indicators highlighted in the box on this slide. So the PBMEF is aligned with WHO definitions for indicators where there's a WHO indicator available for the specific data element. But as I said before, the PBMEF does also include some data elements that are not collected by WHO. Next slide, please. Okay, so this next slide shows a brief snapshot of the indicators that are included and how these indicators map onto our USAID TB strategy. And though the full indicator lists are not shown here, they are available in extra slides at the end of this deck, which will be shared after this call. And the list is also available in the publications that I've highlighted. Next slide, please. So I wanted to go into a bit more detail for the 4 categories within the essential list of indicators. I will say some of these aspects that I'm about to cover may be specific to countries receiving USAID bilateral TB funding, but I do think it's helpful for everyone to be aware of since these terms are often used in PBMEF documents and conversations. So the first group is the core indicators. These are 10 indicators. They were extant in the original publication, so these should be familiar to a lot of folks. So to hopefully reiterate, these core indicators should be reported at a national level for PPR and accelerator calls, which are internal USAID reporting processes. At the USAID mission level, missions should be reporting on all of these indicators through any combination of assigning them to partners. And partners should select as many of these as are applicable. So each partner receiving TB funding must include core indicators in MEL plans to ensure that they're aligning with our priority activities. Next slide. So next is the Core Plus indicators. These should also be reported at national level for USAID accelerator calls. So both the Core and Core Plus are included in those data calls, which happen twice annually. At the mission level, missions should also be reporting on all these indicators for the accelerator calls, and partners again should select as many of these as are applicable. Next slide. So next is the national level indicators. I just wanted to take a moment to say that these should be available and reported at the national level, but if they aren't, project level data may be reported as national data systems continue to develop. So both, could be acceptable depending on the circumstances. Partners should include all relevant indicators in their MEL plans. That's kind of a recurring bullet for all of the essential indicators. That's why they're essential. And these do help contribute to meeting the reporting requirements articulated in Aetna. Next slide, please. All right, so finally, the project level indicators is a larger group of indicators that are expected to be reported at the project level, as data might not be available at national level. Though if the data is available at national level, they certainly can be reported and monitored at that level too. We would definitely encourage that, as they are all indicators that have been identified as essential. Again, because of that, we should be including all of these indicators that are relevant to planned activities for a partner. And again, these really help us to meet additional reporting requirements and to complete essential cascades and analyses that we would recommend to partners. So I think this is my final slide here. We'll go to the next slide, just sharing mine and Savim's contact information. So if anybody would like to reach out, if anybody has any additional questions after this webinar, please feel free to reach out to us, and this work will be ongoing through the SIG. And thank you to everybody who is a part of that group and has contributed to the PBMEF updates to date. It's been a very collaborative effort that we couldn't have done alone. So thanks, everyone. I think I'll hand it back over to Stephanie or Rebecca at this point for Q&A. Thanks.
Thank you, Megan, for that overview of the PBMF and the processes and the products that are available. I'm going to pass it to David, who's going to facilitate the Q&A session. If you haven't added your questions yet, please go ahead and add them in the Q&A, and we will try to get through as many as we can. And those that we don't, we will follow up, work with the presenters and follow up after the webinar. But David?
Thank you, Stephanie. Thank you, presenters, and thank you everyone for your participation and your engagement. There are so many great questions. And so I would like to, just before going through them one by one, I'd like to ask Babis or Savim or Megan if there are any questions that kind of stand out that you wanted to address first as we've looked through the Q&A feature. If not, I can read them, but I want to give you the opportunity to start if with any that you wanted to address first.
David, please go ahead. I've basically been going down and trying to respond to as many questions as I can as I see them. So please feel free to go ahead as you suggested.
Sure. Great. Thank you very much for that. Just wanted to make sure. Okay. Well, thank you all again for your questions. We do have some time, which is great. But as Stephanie said, any questions that we don't get to, we will have all of these captured so we can follow up with you via email. I'll just start from the top and we'll go down. I see one that says, Liberia, I believe this is a question for you, Babas. Liberia is a country where we find TB a major cause of death among young adult and drug abuse in youth. How can WHO help us in dealing with this health crisis?
Yeah, so I mean, if this is a question about comorbidities, or if this is a question about other TB determinants and whether and how this should be addressed at the country level, this is how I understand it. Then I guess the point to make is that as part of the development of the surveillance guidance, what we have done is provided a few examples for determinants for TB and for comorbidities. Of course, every country is different. So when you develop a global guidance, you are what the best you can do is provide some examples, but then of course the countries at the implementation stage will need to carry out the work and really identify which are the most important ones of those to be monitored on the surveillance level and also addressed with specific activities that can take place at the country level. I hope I understood that question correctly.
Thank you, Babas. And I'll stick with you. There are a few, all that came in the WHO section. I did see several questions related to training and related to subsequent opportunities for discussion and really getting a chance to understand the guidance in more detail. Could you just share some of the plans for further training?
Yeah, great. Thanks for that question. So the official, as soon as the official launch happens, and we really think that we're very close. We're at the final stages of the work with the graphic designer. So we hope that we'll publish it next year, and then there will be a series of webinars in all 6 UN official languages, where we will have the opportunity to really go into a lot more detail with some of the material. And then really what we are hoping will happen is during some multi-country meetings or national consultations can then take place to really go through this work in detail. I think that we've already started discussions with a few of our funding partners. I think, as the countries consider the implementation of the surveillance guidance, and by the way, we expect that this is not going to happen overnight. Some of these, any changes or for new indicators or for new data elements to be implemented, you need to train, you need to develop the material, you need to print the material and all that. So we do realize that this is something that will take time and effort. So the rollout will happen from the global level to the regional level, national level, and we will coordinate and collaborate with all our partners to make sure that we are addressing requests as well as we can over the coming months. So there will be opportunities to really delve into the material in a lot more detail, and there will then need to be a discussion at the national level about what this new guidance means in terms of the surveillance systems in the countries. But again, we have time to do that. So, for example, we're not expecting at the WHO for data to be reported on all these new indicators, let's say, this year. This we know, and we recognize that this will take a while to be implemented. Over.
Thank you very much, Babas. I'll go do one more for you now, and then we can do a couple related to the USAID guidance. We'll kind of jump around just to give every speaker a chance to rest as they're answering the questions. Another for you, Babas, would be, I'm seeing one here from George earlier, and it says, question to WHO, the system you have developed is good and similar to the matrix activity system chart. What strategy will ensure that partners using this system do not lose the tracking case by case?
I'm not sure I understand the question, David. When we're talking about I don't know if George is referring to the scope of the surveillance guidance that I spoke about. I'm not sure I understand the question.
Okay, that's fine. I think I see George, you're still here. If you would like to
Okay.
speak, George, I can allow you to talk if you want to expand upon your question. Please feel free to unmute yourself if you'd like. That's fine. And if not, you can just repost your question, George, with a bit more detail, please. Thank you very much. Okay. Let me shift just for a moment so that we try to get through as many as we can. I do see one here. I'm not sure, Savim or Megan, if you all, or maybe this might also be you, Bob. I'm seeing one that says, the person is saying, Patrick says, I thought that the TB incidence reduction and fatality rate reduction in WHO by 2030 are 80% and 90%, respectively, considering data from 2015. What is the starting year to evaluate the reduction? Not sure who exactly that question is targeted towards. Does anyone have thoughts?
It's 2015. It's the NTP strategy targets. The baseline year is 2015.
Thanks, Babis. Okay, great. All right, let me try to find another. Megan, this one's for you. It says, are the USAID indicators already aligned to the new TB WHO surveillance indicators? And if not, what is the mitigation strategy to minimize confusion at country level?
Yeah, thanks for that question. So there are a couple changes in terminology that will come with the new WHO document. And we will be working to make sure that we're fully aligned with all of those in the final release of the PBMEF. So right now, these interim documents are up, but they will be replaced by the fully revised version, and will match the changes in wording for certain indicators. Thanks.
Thanks, Megan. And we'll stick with you. I think that you mentioned this, but if you don't mind just going back over it again briefly in your from your presentation. I'm seeing one question that says, which indicators will be required to report among the core plus, project level, national level under USAID funded countries?
Yeah, so Savim can speak a little bit to this too, but the core and core plus are going to be included in the accelerator calls at a minimum. And then I think that additional indicators from the national and project level, we will encourage including them. Savim, do you want to also chime in? I can also say, sorry, for PPR, for those familiar with that internal process, that will stay as the 10 core indicators. So that will not change. That's going to remain as is. So that's just speaking to the PPR and the accelerator channels. But I'll pass over to Savim.
No, you answered it very well, Megan. So just to confirm, I mean, these are not these required. We have to be very clear how we use that language. The PBMEF primarily is available as a resource for USAID and its implementing partners. And as Megan went through the different groupings of these indicators, for each one of the groupings, like the core, if we can, the core 10 indicators are currently also part of the our annual PPR reporting process. So in terms of required indicators, those groupings are reported on an annual basis in a very standardized and regular fashion. The rest of the groupings, again, in terms of looking at how our implementing partners, what kind of activities they support, and what their scopes of work look like. The rest of these indicators are available, they're standardized, and what we ask is if you have an activity related to case finding, for example, to TB preventive treatment, for the purposes of standardizing our reporting across all of our countries, is to use to look at the PBMEF, the available indicators, because they are very well defined. They have the standard indicator reference sheets and so on and so forth. So instead of reinventing and recreating different measurements, but to really utilize the existing PBMEF indicators. And also for the Core Plus grouping of indicators, we do have a biannual, we call them accelerated calls with our countries, and the Core and the Core Plus, those two groupings of indicators, are being also used during these biannual accelerated calls as well. I hope this addresses the question. I know, and we'll look forward to working with our mission colleagues as well as with our implementing partners to continue this communication and making sure that there's clear understanding what the purpose of the PBMEF is, and how it can help address some of the challenges that we are having also here, and also at a country level with the data generation and data reporting and so on and so forth. Thank you, everyone. Thanks.
Thank you, Savim, and thank you, Megan, for those detailed pieces of information. I want to double back quickly, Babis, if you don't mind, to George's question. He did provide a little bit more context. And again, just a refresher, the question was about the system being similar to this matrix activity system chart. And he was asking about the strategy. What he was saying, I see in the second comment, it was mainly the scope collaborating with implementation of TB cases. I don't know if that helps to clarify the question a little bit more, Babis, for you.
Yeah, not really, but perhaps because I've seen a few comments, and by the way, many thanks for all these excellent comments. I'm trying to respond to as many as I can, but I think we can make sure to really take this offline as well with some of you. I think these are some excellent points. So on this, there's a lot of comments and questions on really this idea of integration and interoperability, and really where do TB surveillance systems fit? And I think this is a really important one to discuss. I think what really we are suggesting and promoting is collaboration across the different parts of government. I think we need to recognize and understand all the excellent work that has happened over the years by TB programs, by other programs as well, but particularly TB programs in establishing strong surveillance systems. And I think we need to use that work that has happened to really support the overall public health architecture. So really the idea behind this surveillance guidance is to make sure that TB programs and partners are really starting to think about, about that. And integration is a dangerous word, and I know that we can be talking about this for hours, but really the idea is to promote the collaboration between the different parts of government, between the health information systems people at the Ministry of Health and the disease programs people, different sectors, so the public sector and the private sector, really try to find interoperability solutions, but not stop or kill existing surveillance systems, but rather build on the excellent work that has happened by disease programs so far, and really get to and support a public health surveillance architecture overall. I don't know if that answers this specific question, but I did want to talk about that because a few of the comments have addressed this issue of integration and interoperability, and I think we need to be very clear about that. Over.
Thanks, Babis. Thank you very much. Let's stick with you, Babis, on another that I'm seeing here. This one is from Charles, and it says, to what extent is the WHO going to support countries to transition to digital case-based surveillance systems, given the investments required for equipment, internet, especially at low levels of the health system, and avoiding perpetuation of verticalized surveillance approaches?
Yes, thanks for the question, Charles. So WHO is not a funding agency, right? But we are in collaboration with all the major funding partners. We're in collaboration with major players in digital health. So what we have done is we have done the work on developing the metadata that then the IT companies can take on and use as they're developing digital surveillance systems that are collecting all the recommended, for example, indicators, and they're carrying out the recommended analysis of all those indicators to really promote the analysis and use of data for policy planning and programmatic action at the country level. So there is a global network of partners that can help countries. I think Charles, I think it's from Zimbabwe. So there is particularly countries that are eligible for USAID funding, for Global Fund funding. There is a network of partners that can support countries transition from paper systems to digital systems. So I think for anyone who is interested, you can drop us an email. I'm sure Charles is already aware of the work that has happened on DHIS2. But even beyond that, we have done the development work, we have done the preparatory work rather of translating all the WHO guidance and clinical guidance and surveillance guidance into a set of products that the IT partners can take on and develop surveillance systems overall. And I believe there is actually funding available for the digitization of the surveillance systems, particularly for countries that are eligible for international funding. Over.
Thanks, Babis. Thank you all for bearing with me. I'm trying to get to both sides of the questions, the different presentations. So I'm going to jump back to Megan for a moment here. Megan, I'm seeing a question asking, are you planning to include indicators related to community-led monitoring in the USAID reporting cascade/tools?
Community-led monitoring, we don't have an indicator on that right now on the essential list. We may have in the extended list, but I would encourage you to engage with the SIG and recommend that if it's an important thing that you'd like us to develop an indicator reference sheet for and include in our compendium. I should mention too that once the final revision is completed, we will establish some system for feedback. So if there is a gap that you identify in the PBMEF or something that you'd like to see included that's not already there, there will be a route to adding things or amending things. Thanks.
Yeah, thank you for that, Megan. I do see maybe one or two other questions about, maybe an indicator that might be suggested or something that could be missing. So as Megan said, there will be a forum where feedback on the indicators can absolutely be supplied. So I'm gonna bypass some of those questions for now, if you all will bear with me. Let's see, just looking for something else that's related. I'm not sure who this question might be for, so I'm just going to read it and please feel free to take a stab at it, presenters. This is from John, and it says, about digital surveillance and health facilities, how can we use the post-TB care? Does anyone have any thoughts on that question?
This might be related to the slide that I showed on the expanded scope and the various and establishing a surveillance system that allows you to collect data throughout the full pathway of prevention and care, including the post-TB care and disabilities, TB disabilities and all that. So that is the vision. The vision is to be able and and follow through once a treatment completion is done. Again, this is something that needs to be adapted at the country level at the moment. And perhaps the other thing I should say is that there is currently work that is being done at WHO to develop some specific guidance on well, whether it's referred to as post-TB care or disabilities, TB-related disabilities. I mean, the terminology is still being ironed out at the moment, but there will be some new guidance on that. So just I would say watch this space for now. Over.
Thanks. Thank you, Bhavesh. And we'll stick with you. I see one that I think is somewhat related. It says, how does the new WHO TB guidance address surveillance in countries that are in between paper and digital systems? Are there indicators or strategies that should be used during this sometimes lengthy transition phase?
Yeah, that's a great question, because in fact, there's a lot of countries that are in that situation. A lot of countries that have introduced the case-based digital system, but have not fully rolled it out in the whole country. Perhaps the coverage is not fully there. So I would say that if you remember, we have a core set of indicators that we recommend irrespective of whether a country is using a paper-based system or a digital system. So really, this is the core set of indicators. So I would say focus on those and then put the effort and perhaps the funding to really try to strengthen the digital surveillance system and reach full coverage of the system in the country, make sure that the quality of the data that the system produces is high before we then move on to collecting data and reporting on a lot more indicators and a lot of the other disaggregations. So, and this is something that we have seen from epidemiological reviews, particularly, we have seen, for example, a lot of disaggregations that were being that countries were trying to report on and all that, and it was creating for countries that had paper-based systems, all these disaggregations at the health facility level are actually quite problematic and difficult, and there's a number of data quality issues. So really what we are recommending is focus on the core set of indicators, and instead of trying to report on all these additional indicators, if you don't still have a digital case-based system, put your effort and your funding into strengthening that system before you get to the reporting of this expanded list of indicators. Over.
Thank you, Bhavesh. I think that this question might be one that we could get some insight from both the WHO and USAID sides. This question is from Syed a little bit earlier. It says, what is being suggested, or what suggestions would there be from both WHO and USAID to mitigate the difficulty of entering significantly large data volume for TB? The care providers at the facilities with large patient inflows daily and also providing TB services are the ones under, and then it ends up with incomplete recording. Do you recommend any speech to text type of applications, or just any thoughts or ideas on data entry in that particular frame? Any thoughts?
Yeah, so I can. Sevim, do you want to go first, or should I start?
No,
To this
please start.
nice and easy question. Okay. So what I would say to that, I mean, I'm thinking, I'm thinking particularly some, let's say, settings where, some huge primary healthcare facilities where there's a very large number of people showing up at OPD and all that. I think the most important thing we should try and do is consolidate the data entry. It's really try to make sure that we capture the data once, and then we use it for multiple purposes. I think capturing the data, whether it's on paper, on digital, I mean, that's important. We have to do it no matter what. So for me, the effort would be to try and streamline the data entry and data capturing process, and make sure that we only ask our frontline workers, our nurses, our people who our data clerks to capture that information once, in clear registers and forms, and then have very clear guidance about how that data is aggregated and analyzed and used. For me, that would be the huge battle that we need to win. Of course, then after that you can go fancy with with digital tools that can facilitate that work. You can think about abridged reporting of cases. When you're talking about the private sector, we've been piloting that for Indonesia. Rather has been piloting that where in the private sector, instead of asking the private sector to capture full information on a TB case, to actually really restrict it to a very small number of data elements. So these are just some ideas and examples from me. Sevim, over to you.
No, I would totally agree with you, Babis, and I'm also not a expert on some of these innovations in IT and artificial intelligence, and definitely for the future there might be some opportunities. The field is rapidly developing, but my colleague who is posing a really acute question for all of us, as we all know that in terms of the our TB programs are generating a lot of data, and data entry and data collection, data generation takes quite a lot of effort and resources for the programs. And in my personal opinion, and most of you have heard me say this before, our issue with TB data is not the availability of data. We're not talking about more collection of more data, but how do we make better use of the existing data, as Babis is saying, in terms of how we can synthesize it, summarize it, and make sure that we have different uses for these data. And that's why this is really critical for us. Both the WHO surveillance guidelines as well as the PBMEF should be really put in that perspective, is to help us with the standardization of data that can lead to also better use of data for programmatic decision making, and really capitalize on all the effort that goes in generating these data at a country level, at a subnational level, and especially at the different facilities level. Yeah, excellent question, though. Excellent question. If you have any ideas how to how to digitalize and make the data entry less burdensome for our colleagues on the front lines, definitely please share those with us as well. Thank you.
Thank you, Sevim. Thank you, Babis, for answering that question. Just continue scrolling on. We've got about 5 more minutes. So I'm going to see if we can get through a few more. Thank you all for your patience. Thank you so much. We almost have 400 of you sticking with us for this discussion. So we want to just acknowledge your participation. I'm gonna toss this one back to you, Megan, for a second. I know that we have mechanisms that will be developed, as you said in the chat. Thank you for clarifying that those mechanisms are still being set up for feedback on specific indicators within the PBMEF. But for the time being, you're welcome to reach out to Megan. I just want to toss this one back to you to see if you have any thoughts on maybe indicators of this type or in a particular category. I see a question saying, I could not see an indicator capturing data from other public sector. And it says that it was previously called parastatal sector, I think, like Army and police. Hopefully I said that correctly. Any thoughts on that, Megan, in terms of just other categories or just any thoughts in general related to indicators of this type?
Yeah, thanks, David. No, I think it's really good. And I've been making notes too for myself. I think this is a very well-timed webinar to get this kind of feedback since we are in the middle of our revision process. I don't believe we include any language right now that's talking about the specific entities that were mentioned in the question. So I will note those down and see if we can be more specific about where we can capture those within our indicator structures. But yes, please feel free to reach out to me with any, suggestions, since that feedback mechanism hasn't been established, or feel free to join the SIG and get in the mailing list. You'll receive calls for review for documents, and there'll be various mechanisms and ways that you can give feedback as we shape this up too. So thanks.
Thanks, Megan. Much appreciated. And I'm going to put the link to join the SIG here in the chat in case anyone else is interested. We have some really great discussions. I would love to have you all participate, those of you that are not already a part of it. I'm going to ask this question. This is still kind of going back to that paper-based digital discussion, which I think is a really important one. This question is from Aaliyah, I believe, and it says, is theory of change information applicable in the transition process from paper-based to digital reporting of TB cases?
Well, the simple answer is yes, theory of change can be applied to everything. But so if what you're asking is, should you be developing a theory of change of whether you should actually put the effort and money into it, why not? But personally, I think there are some very, very clear advantages about establishing digital surveillance systems as opposed to having paper-based systems, and we are explaining some of that content in the surveillance guidance, but then again, of course, everything needs to be balanced and weighed. So I think if you have someone who can develop a theory of change in that context, in your country and your setting, why not? I would say go for it. Over.
Thank you very much, Babis. We're just about at time. I think I'll post this last question for now. And as a reminder, we have all of these questions captured, and I'll be sure to share them with our panelists so that we can respond to those of you that have posed them via email. There's a lot of questions here just with some specific advisement, which I think is great, and it'll lead to some really great discussions offline. One question I think is very interesting, and I don't want to mess up the name, so I'll refrain. I do see one that says, some countries I'm working with are currently in the process of adapting the TB DHIS2 tracker before rolling it out. Do you expect any revisions in the standard tracker anytime soon, perhaps during 2024?
Okay, I can take that. So the short answer to that is yes, we will be. We have already started the process. So what has currently been published on the University of Oslo website is the latest metadata translating the WHO clinical guidelines, and most of what will feature in the new surveillance guidance. Some of the terminology hasn't changed yet, so that will come this year. So we will be updating the digital packages for aggregate level data and case-based data to be fully aligned with the content that will be published in the new surveillance guidance. But that's going to happen throughout the year. So if you're already doing that in your country, I wouldn't suggest that you stop and wait for it. I think we can actually, depending on the country and whether the partners are interested, we will be more than happy to collaborate with you and perhaps pilot this work in some specific countries that are currently in the process of adapting the DHIS2 packages. Over.
Thank you, Babis. Well, we are at our time. I just want to thank all of the presenters. Thank you all so much for your insight, your presentations, as well as for managing the great questions that we've had today. Thank you, all of you attendees. So many of you stuck with us all the way to the end to be a part of this discussion. We are extremely grateful for your participation. We will follow up. You will receive the presentation as well as the slides and the recording via email no later than tomorrow. And we'll make sure that we connect the presenters to your questions so that you can be followed up with. All right. Thank you all. Have a great evening. Those of you that it's nighttime, have a great day. For the rest of you that it's daytime, we appreciate your participation. Thank you again, presenters, and we wish you all a wonderful, wonderful day.
everyone.
You.
Thanks, everyone.